Let's just get right into it. If you work in the ER, you already know how fast things can turn. I mean, a patient's status can literally crash from totally stable to absolutely critical in a single heartbeat. For all you physicians, residents, and nurses out there grinding in this high-pressure world of emergency and critical care, you know the stakes better than anyone. You're right there on the front lines. So consider this explainer your ultimate roadmap to really mastering that chaotic environment.
Okay, let's dive into this. Picture that critically ill patient right in front of you. Every single minute counts. There is absolutely zero room for hesitation, right? Every clinical decision you're making in that exact moment has the real potential to save a life. It demands razor-sharp critical thinking, even when the pressure is just immense.
But to navigate those really high-stakes moments, you need a seasoned guide. So enter Dr. Richard Alexander Sarablanco. He's an emergency medicine consultant and an ERC-certified resuscitation instructor. The core mission here? It's simple. We're talking high-quality, evidence-based education that aligns directly with the absolute latest international guidelines. We want to literally skyrocket your bedside confidence.
Now, while we definitely put a heavy focus on adult and pediatric CPR, we know the reality of your practice goes way beyond just that. We're going to map out the most critical emergencies you're facing every single day. We're covering cardiovascular emergencies, respiratory crises, renal and urinary disorders, digestive and hematological emergencies, right through to those intricate neurological emergencies, metabolic and endocrine disorders, and acid-base disturbances. It's the whole shebang.
Let's move to and see how this builds, because tackling a list that massive requires a completely bulletproof methodology. So we break things down systematically. First up, clinical presentation. Then, diagnostic strategies. And finally, evidence-based management. You know, it's a highly reliable, step-by-step process that you can actually trust when you're exhausted at 3 a.m. in the trauma bath.
And this brilliantly illustrates a crucial point. Medicine is continuously evolving. So just blindly following protocols, that simply isn't enough anymore. We really have to bridge that gap between what we do, our direct clinical actions, and why we do it, which is the scientific evidence actually backing those actions up. Translating all that evidence into safer, better patient care, well, that is the true hallmark of clinical excellence.
At the end of the shift, it all comes down to this: improving patient outcomes. We're doing it one lesson, one decision, and one life at a time. So make sure to subscribe and hit those notifications to join a community that is just fiercely committed to clinical excellence. I'll leave you with this to think about. When that next critical patient rolls through your doors, will you be armed with the absolute best evidence to save them?